Hello friends, I am Dr. Meenesh Juvekar, E.N.T and Cochlear Implant Surgeon from Juvekar's Nursing Home, Chembur and Bombay Hospital, Mumbai. Today I am going to talk to you about a technology that has transformed the lives of many children and adults. 1 out of 250 babies born in India are having hearing disability. We have a large number of children and adults both in our country having hearing disability of various kinds. Today we are going to talk and discuss the technology which has transformed the lives of many individuals. It is the technology of cochlear implants. Cochlear implants can be done in both children and adults. A person having profound hearing loss who does not have any benefit with hearing aids are the ideal candidates for cochlear implants. In children, once they have no hearing, they have a delayed development in their speech and also progress in school and other activities. In adults, hearing aids might not be effective beyond a certain hearing loss. In these individuals, a cochlear implant is very beneficial to try to get them into the mainstream of life. The aim of the surgery is try to give the person an appreciable good hearing so he leads a normal life not only in his schooling, job but also his day-to-day social activities. Cochlear implant surgery is now a relatively simple surgery that can be done. The average surgical time for this procedure is not more than 2 to 3 hours and the patient goes home in a maximum period of 2 to 3 days depending on his medical condition. What happens in children or adults who have a hearing disability is that the cochlea, which is the main functioning unit of the ear, does not function or malfunctions. As a result, the sound would be reaching the cochlea but not beyond that. Hence, we have the technique of cochlear implant surgery. Now, what do we do in this implant surgery? There are two parts of a cochlear implant. One is the implanted device which you see here, which has an implant and an electrode which is implanted surgically behind the ear. This electrode directly stimulates the nerve or the auditory nerve. Once the surgery is done, we have a speech processor or the processing unit of the implant which is attached to the individual behind the ear via a magnet. So this processor absorbs the sound externally and transmits it to the implant, which in turn stimulates the auditory nerve. How will a common man know that his child or his relative would actually require a cochlear implant? It's very simple, friends. If you have a newborn baby, the mother does have to look out if the child is hearing well or not. Simple sounds can be elicited on a baby's face once they are hearing. If at any point of time you feel that you have a child in the family who is not hearing well, you immediately should try to take him to the nearest doctor to try to get his hearing evaluated. We have certain tests called BERA and OAE in which we can evaluate the hearing of the child as small as a 10 or 5-day-old baby also. Always remember, the earlier we have intervention in these children, the better are the results, because that's the way the human brain accepts sounds and helps in development of that individual. In an adult or a senior citizen who are wearing hearing aids but are not happy with the result, it is important to evaluate, get your hearing test done and consider yourself for a cochlear implant. It's important to understand that a hearing aid works with an entirely different technology compared to a cochlear implant. A hearing aid simply amplifies the sound, so you might not get what we call as a proper speech discrimination score or a proper hearing perception with a hearing aid in all individuals? First, let us discuss about cochlear implant surgery in children. A child speaks or learns different languages as he hears. So it is but natural that when a child has a hearing disability, he either has a delayed milestone when it comes to his speaking, or he does not develop any speech. As a result, it has been proven that the earlier the children are implanted with cochlear implant surgery, the faster they become normal to develop their speech. Some children have been implanted as early as 6 months of age, but the maximum development of the child's speech and improvement starts from 6 months to up to 4 years of age. As a result, when these children are implanted, they enter the mainstream of life, go into normal school, normal colleges, and lead a normal life, especially when it comes to their education. What happens in a human mind is when you do not have a sound stimulus coming into your brain, you go into some sort of a depression, loneliness, as you are not able to converse with other individuals, as you are not able to hear certain sounds, and you are away from your daily social activities. In these individuals, cochlear implant immensely helps to try to stimulate the nerve and give them a normal hearing, which they will not get by a hearing aid. As a result, the quality of life of these individuals improves drastically immediately after the surgery. At Juvekar's nursing home in Mumbai, in the past 2 years, we have operated more than 200 children for cochlear implant surgery. Thank you for your patient hearing. In case you need to have any more information or queries about cochlear implant, please do log on to our website given below. Thank you very much.